failure.
Reprise de débat, continuing debate. The honourable member for Calgary Centre.
Thank you, Mr. Speaker. Thank all my colleagues for coming here today to listen to my speech, my colleagues on this side of the House in particular. It's an honour to stand in front of this House and actually talk about a bill that's going to affect Canadians for a long time going forward here. Another trinket, if you will. Let me start, because it is a big bill, but I'm going to start by focusing my comments on the dental care benefit that's part of this bill. It's Bill C-31. And I see the Liberals over there shrugging their shoulders about the support that they've given the NDP when they brought this motion, this legislation forward here. Let me say they know it came cheap, the support from the NDP to continue on with their supporting their government. Dental care is a cheap trinket for them to actually push forward here. This House will note that this government, that they've aligned the NDP with them continuing to drip a dental care plan into delivery with their continued deficits. And why wouldn't they? No sooner would the Liberals deliver on their full promise for dental care than the NDP would up their demands for continued support of this spendy government. So who's playing whom in this support agreement that allows the Liberals to continue to plunge the country into an economic hole that will take decades of responsible government to recover to our previous fiscal stability? That's why dental care is in front of this House. Not because of any health reasons, not because it's going to give something to Canadians that has been taken away with the inflation that's causing, obviously, a dent in their take-home pay. It's a political support agreement so that the NDP could show people that they might be relevant, even though they're backing a government whose spending is out of control. And a great amount of taxpayers' money is going to Liberal lackeys. Dental care support, it's a nice gift. Like my colleague said earlier, it's a nice shiny trinket in the window. Dental care promotes good health, no doubt about it. Oral health leads to better health overall. We've known this for years. So I spoke to a friend at home, and she brought it forth me, and she asked about why the federal government shouldn't establish a new federal bureaucracy in charge of Canadians' dental care. Why an Ottawa knows best approach to superimpose a new federal program on top of the existing provincial dental program across Canada. Programs, because I believe each provincial jurisdiction has a provincial dental care program. How costly would the program be? How much taxpayer funds would be spent or lost in bureaucratic overlap? Federal bureaucrats interacting needlessly with provincial bureaucrats in a program that's already being delivered in every province across Canada. Not a health transfer to fix an underfunded healthcare system in Canada, but a new program overlap. Let's ask the NDP about the Halloween candy they bargained for with this government. It's provincial responsibility. Did any premier, including the NDP premier in British Columbia, ask for dental care funding in their provinces? The answer is a very clear no. What did the premiers ask for? An extra $26 billion from this federal government to help the strain on our healthcare system. A strain that has been exacerbated by a pandemic that lasted 2 years, and obviously costs thrust upon the shoulders of the provincial governments. Notably, all of this is provincial responsibility. The Canada Health Act imposed standards of healthcare delivery on the provinces, so it was a shared jurisdiction for a while. Healthcare was funded 50-50 between the Liberal budget cuts of the mid-1990s, when suddenly they were changed. And that became not the 50-50 that the Healthcare Act was premised upon, but now, Mr. Speaker, 22% of healthcare funding in Canada is funded by the federal government. And for every province, healthcare spending has become the largest budget item. This government has been running huge budget deficits the entire 7 years they've been elected. So with this new program, they're going to continue to buy Canadians with their own money and continue to put it onto the backs of taxpayers who aren't paying taxes today, who may not even be born today. So this intergenerational transfer of taxation versus the benefits that are being felt by Canadians today is unjust. The country's finances right now are more strained than they have been since the Liberals cut health care funding in the 1990s. Perhaps the NDP needs to take a lesson from history about how this ends. My friend in Calgary and I, we did a little more research on dental coverage for people in my province, Alberta. Alberta child care benefits provided full dental coverage for low-income families. Notable differences, of course, between the Alberta plans and the proposed coverage in this bill. Alberta plan covers low-income households for full coverage up to the age of 18 in low-income families. This new plan is for low-income families to cover children up to $650 per family, up to the age of 12. In Alberta, it's up to the age of 18, no matter the number of children. Additionally, the definition of low income ends in Alberta at $46,932, again to cover 100% of the dental expenses of children under the age of 18. This new program gives a sliding amount per family up to a family income of $90,000, down to $260 per family. Will there be overlaps with these different definitions? Well, of course, and obviously. Private insurance that pays out first, provincial insurance on top of that, which goes second, and then the federal plan. So is this just another public service jobs debacle on the horizon? All different formula and all different eligibility. This spells huge bureaucratic overlap in the delivery of this new service. Obviously, we're going to have to hire more federal government employees on top of the 15% increase we've had over the last 2 years. We're on a job hiring spree and we're getting less and less from federal government services. Surely a realistic, accountable federal government could deliver a program like this a little more effectively. Unfortunately, a realistic approach to better dental care wouldn't allow this government to buy the support of the NDP. This is another Liberal NDP boondoggle. Canadians deserve better. Not just optics, but actual delivery of programs that help them and don't overlap with all of their other provincial benefits. Let's talk about inflation and how this is actually impacted. Every Canadian is having more expenses, including dental expenses, including expenses for food, including expenses for their housing, which is pronounced and actually is addressed a minuscule amount in this bill. These are all mounting expenses for Canadians, and this government has thrust this upon Canadians with their full-on federal spending of over $500 billion in deficits over the past handful of years. It is a ridiculous financial strategy that has led us to where we are today, with mounting inflation, with mounting government debts, with no end in sight to actually how this ends or where it ends, except on the backs of future generations of Canada. Cost of living is going up, inflation is going up, deficits are going up, and this government doesn't have a handle on how they actually deal with those real problems that are affecting the lives of Canadians. Their approach is to give trinkets in this bill that will not be able to deliver, but will have a huge cost upon the Canadian population writ large. Thank you, Mr. Speaker.
Questions and comments? Question commentaire. The Honourable Parliamentary Secretary to the Government House Leader.
Yes, thank you, Mr. Speaker. You know, the member talks about trinkets, and I can assure the member that not every province is alike. You will find if you're a 10-year-old child or an 11-year-old or a 4-year-old child, depending on the province, there's different types of dental programs that are available. But what we do know for a fact is that there will be tens of thousands of children in every region of the country that will benefit by this dental benefits program. We know that for a fact. Yet the Conservatives seem to want to deny those tens of thousands of children to be able to have a dental benefit. Many of those children will end up in hospital situations, we know that for a fact also, as a direct result of not having the types of benefits that are being proposed within this legislation. Will the member at least acknowledge the fact?
The honourable member for Calgary Centre.
Well, thank you, Mr. Speaker, and I watched my colleague listening to my speech intently, but he seemed to have missed much of what I said. There is dental coverage. There's different dental coverage in every province. There is a better way of delivering increased dental coverage if the federal government actually wants to contribute to the provinces that are actually delivering healthcare services across this country. These are different modes. You think about the way Canada is governed. We're governed in a federal system. We have provinces deliver real services to their constituents. We, as the federal government, also have our realm. This is very clearly provincial realm. If the federal government wants to be involved in dental health care, say so, put some constraints on the provinces, some direction on the province, and transfer some funds. Don't give it as just a gift to the NDP to stay in power, which is a really obvious power buy at this point in time. Thank you, Mr. Speaker.
Questions et commentaires, questions and comments. L'honorable député de Lac-Saint-Jean.
Monsieur le Président, merci. Je veux souligner le discours de mon collègue de Calgary Centre. J'ai bien apprécié, j'ai surtout apprécié qu'il a fait allusion au transfert en santé. D'ailleurs, il vient d'en parler un peu là, des différentes juridictions là, du fédéral et des provinces dans sa réponse à notre ami de l'autre côté de la Chambre. Maintenant, il y a une chose qui me déçoit un petit peu, Monsieur le Président, je vais vous le dire, du côté conservateur. Ça fait 3 ans que je leur pose la question. Et jamais j'ai eu de réponse, mais je sens que j'ai peut-être une chance avec mon ami de Calgary Centre. C'est quelqu'un d'honnête, quelqu'un de fiable. Il va nous le dire, il va répondre à cette question-là. Le premier ministre du Québec et ceux des provinces se sont entendus. Et la demande, elle est formelle. Et le consensus, il est solide. Ils veulent qu'on augmente les transferts en santé à 35 %. En 3 ans, j'ai jamais entendu un conservateur me dire que oui, ils accepteraient d'augmenter les transferts en santé à 35 %. Pour un parti qui se targue d'être le parti de l'économie, est-ce que c'est possible, une fois pour toutes, pour eux, de chiffrer les transferts en santé, l'augmentation des transferts en santé? Je demande à mon ami s'il est d'accord avec le Québec et les provinces. Il faut augmenter à 35 % les transferts en santé. Merci, M. le Président.
L'honorable député de Calgary Centre.
Je remercie mon collègue pour la question, M. le Président. Je ne suis pas au courant de le nombre de 35 % qu'il a mentionné dans son question, mais je suis certain que les premières du pays ont demandé au gouvernement fédéral de donner un autre 26 milliards par année pour le système de santé au Canada, du gouvernement fédéral aux provinces autour du Canada. Mais ça, je ne suis pas certain si le montant de 26 milliards de dollars est équivalent à 35 %. Je suis désolé de n'être pas au courant des chiffres là, mais j'appuie bien les demandes des provinces de donner plus d'argent du fédéral aux provinces. Merci beaucoup.
Questions and comments. Questions et commentaires. The honourable member for Nanaimo Ladysmith.
Thank you, Mr. Speaker, and thank you to the member. You know, I had an adverse reaction to to dental care, having access nationally to dental care as being referred to as a trinket. It's very problematic to me when I hear day in, day out from constituents and Canadians across the country that they want access to dental care. We know dental care also having access to it saves us money. There's no economic reason. We actually are going to be proactive in preventing the cost to our healthcare systems. And so I'm wondering if the member could share what he has to say to constituents in my riding of Nanaimo Ladysmith and Canadians across the country who are asking for dental care, and instead he's referencing it to it, in my opinion, belittling the need for dental care by referencing it as a trinket.
The honourable member for Calgary Centre.
Oh, thank you, Mr. Speaker, and thank you, my colleague, for the question. I called it a trinket in my speech. It is a little thing for the Liberals to put in the window to show the NDP that they're actually relevant to the support agreement that they've given here to continue to have this government supported by them over the short term until it's actually done. Giving dental care to Canadians is easy. As I said in my speech, and I hope she was listening, there is a far more effective way to improve dental care across this country, and that is to actually transfer health dollars to the provinces, as we spoke and as my friend in the Bloc Québécois also answered. To call it a trinket means that here's something we've given that has to be identified here that's going to create a massive overbuild and more public servants required to deliver that. That is the overstep here. It is provincial responsibility. If the federal government wants to deliver this to the provinces, and if she actually has her constituents putting it in the top 10 needs of Canadians, then this is the way it should be more effectively done. Thank you, Mr. Speaker.
Continuing debate.